Hello friends. A recent report by World Health Organization on COVID deaths has led to a war of words between the organization and the Indian government. A resolution was passed at the three-day conference of the CCHFW, an apex advisory body of the Ministry of Health and Family Welfare, strongly objecting to WHO's estimates of COVID deaths in India. It stated the WHO estimate is unacceptable to India and the modeling methodology used by the global health body to reach the figure was flawed. The meeting was chaired by Union Health Minister Mansukh Mandaviya. Apart from this, some experts and political leaders have spoken in support of the World Health Organization report and have called out the Indian government, alleging them of misrepresenting data. In this video, let us look at what the WHO report says, why is the government denying it, on what basis WHO is making such claims, and what do the experts have to say about it. Before we move ahead, please subscribe to the Upfront and press the bell icon to get notification of all our updates. I'm Nihal Muhammad and you're watching the Upfront. What does the WHO report say? COVID could have killed as many as 47.4 lakh people in India in 2020 and 2021, either directly due to infection or through its indirect impact, the World Health Organization said. The figure disputed by India is nearly 10 times the country's official COVID death toll of 4.81 lakh at the end of 2021. In its report on excess deaths due to COVID, WHO said that an estimated 1.5 crore people are likely to have succumbed to the direct or indirect impact of the disease globally during the first 2 years of the pandemic, instead of the 54 lakh that have been recorded officially by countries separately. For India, the WHO said about 8.3 lakh deaths are estimated to have happened in 2020 itself. The high-income countries account for 15% of these deaths, upper middle-income countries 28%, lower middle-income countries 53%, and low-income countries 4% as per the report. India alone accounted for a third of the total numbers according to WHO. Among other countries in the region, Pakistan accounted for 1.54% of excess deaths, that is 2,30,440 deaths, Bangladesh 0.9%, that is 1,40,765, and Myanmar 0.29%, that is 44,187. Countries such as Sri Lanka and China reported a negative total of minus 8,833 and minus 52,063 respectively, meaning fewer people died there during the pandemic years than earlier. Why is the government denying it? India has rejected the WHO report, calling it statistically unsound and scientifically questionable. Health ministers of various states who attended the 14th conference of the Central Council of Health and Family Welfare (CCHFW) have slammed WHO for its estimate of 4.7 million COVID-related deaths in India, saying it is baseless and intended to show the country in a poor light. They said India has a robust, efficient and comprehensive system for registering deaths, and all COVID-19 fatalities are systematically recorded transparently following a legal process. The Union Health Ministry strongly objected to the mathematical models used by WHO for projecting excess mortality estimates linked to the pandemic, given the availability of authentic data, saying the validity and robustness of the models used and methodology of data collection were questionable. India had also informed WHO that given the availability of authentic data published through the civil registration system by the Registrar General of India, mathematical models should not be used for projecting excess mortality numbers for India. India firmly believes that such robust and accurate data generated through the legal framework of a member state must be respected, accepted, and used by WHO rather than relying on less than accurate mathematical projection based on non-official sources of data, the statement added. Sources in the ministry questioned why their technical experts were not allowed to verify the data. How can a member state-driven organization collect data from other sources even when the government data is available? Why were only 17 states selected? Why did the estimated number of deaths keep jumping from 13 lakh to 33 lakh to 63 lakh and then 47 lakh, sources said? Did they collect data over a time period or model the monthly excess mortality based on data from an instance? For example, if mortality from Kerala or Maharashtra is extrapolated for the whole country, it would be wrong because those two states saw high mortality throughout the year. Or if data from the peak of the second wave is extrapolated for the entire country over the 2 years, it will give an unusually high number, sources said. On what basis WHO is making such claims? The WHO states in its report that the estimates may not be regarded as the national statistics officially produced by India due to differences arising from the data and methods used by WHO. According to WHO, the deaths linked indirectly to COVID are those that happened due to conditions for which people were unable to access treatment because the health systems were overburdened by the pandemic. It also accounts for fewer deaths due to road accidents, etc., when lockdowns were in place. These sobering data not only point to the impact of the pandemic but also to the need for all countries to invest in more resilient health systems that can sustain essential health services during crisis, including stronger health information systems, said Dr. Tedros Adhanom Ghebreyesus, WHO Director General. What do the experts have to say about it? The COVID-19 excess death estimate for India by the WHO only falls within a range of estimates put forward by different studies, including some in peer-reviewed scientific journals, and there is no reason to discredit it. Moreover, unlike what the government claimed, the model by WHO did use available subnational data from India, said Rijo John, health economist and adjunct professor at Rajagiri College of Social Sciences, Kochi. I agree that WHO is more likely to be right on the numbers. Exact figures are always hard, but we know the issues with vital registration as well, said Gagandeep Kang, noted microbiologist and virologist who is the professor in the Department of Gastrointestinal Sciences at the Christian Medical College, Vellore. In the middle of 2021, some activists had come out with accusations of massive undercounting of COVID-19 deaths in the country's most populous state, Uttar Pradesh. Most public health experts agree that there has been some undercounting of deaths due to the political pressure on states to perform and the challenges in the civil registration system, but the scale of undercounting mentioned in the WHO report has surprised many. A study published in The Lancet, one of the most respected medical journals in the world, indicated an excess mortality of 4.07 million, which is 8.33 times more than the reported COVID-19 deaths during the same period. The study was primarily led by a group of researchers from the Institute of Health Metrics and Evaluation of the University of Washington in Seattle and had several venerated global universities assisting them. Another study by The Economist had also shown 10 times higher mortality than official numbers during the 2021 period in India, though the confidence interval for the estimate was very wide. There can be several caveats about the unreliable sources of data and the quality of the models or algorithms, but the fact is that official mortality figures are much lower than the predictions. The open query is about the proportion of underreporting which has happened during the period and its possible reasons. Whether we can attribute all the excess mortality to COVID-19 is another question altogether. Many other reports have also suggested the same. All this shows us the need to invest in improving the quality of our civil registration system and making real-time data available to researchers across the world. With the remarkable progress achieved in e-governance initiatives, it is quite possible to collect vital statistics without impinging on the privacy of our citizens. The spectacular success of our vaccination vaccination program should serve as a template for proactive government interventions in collecting and compiling vital statistics and epidemiological information. But above all, the government should be focusing on improving the public health infrastructure in the country to prevent a repeat of the tragedy which unfolded in the country during April-May 2021. That's it for today. If you like the content we provide, please subscribe to the Upfront and press the bell icon to get notification of all our updates. Please share our videos and educate others. Thank you.